Hi, my name is Pam Killeen, and welcome to my seminar, Living Without Asthma. I'm very excited to share this information with you today because it was a few years ago now when my own clients actually taught me about the Buteyko breathing method. Now, at first, when I learned about this breathwork, I thought it was breathwork just like any other form of breathwork out there today. And boy, was I wrong. The Buteyko breathing method has a proven track record of helping people struggling with respiratory conditions of all kinds, including asthma, rhinitis, sleep apnea, and snoring problems. In fact, this breathwork has helped thousands of people all around the world recover from a variety of different respiratory conditions. Now, in this seminar, I'm going to be talking about three prominent health pioneers and how they're all interconnected. First of all, I'll be talking about the work of Dr. Weston A. Price and the role that the stressful diet plays on our overall health. Then I'll be talking about the work of Dr. Hans Selye and how stress in general adversely affects our overall health. And finally, I'll be talking about the work of Dr. Konstantin Buteyko, who is the researcher who discovered the connection between overbreathing and illness. So thank you so much for spending your valuable time with me today, and I hope you enjoy the rest of the presentation. Throughout this presentation, I'm going to be helping you connect the dots between these three prominent health pioneers, Dr. Weston A. Price, Dr. Hans Selye, and Dr. Konstantin Buteyko. First, I'm going to be speaking about Dr. Weston A. Price. Now, Dr. Price was a dentist who, in the 1930s, started noticing changes in his pediatric patients. He started noticing that they were developing cavities, crooked teeth, and a narrowing of the jaw. And because he was treating the parents of these children, he got very curious because the parents had beautiful dental health. They didn't have the cavities, crooked teeth, or the narrow jaws. So he started wondering what was causing this problem. And he recorded his findings in the book Nutrition and Physical Degeneration, which is probably the most important book ever published in the area of nutrition. So what Dr. Price did was he set out to travel all around the world and actually lived in primitive cultures so he could study what they were eating and at the same time examine their overall health, not just their dental health, but their overall health as well. And what he found out was that in traditional cultures where they maintained their ancestral diet, which would have included a lot of nutrient-dense foods, that they enjoyed a robust overall health and at the same time had beautiful dental health. Now, when he would compare these primitive cultures to villages or tribes that were importing modernized, industrialized foods, that in these more modern cultures, they actually started to develop the same problems he was seeing back in the United States. He started to see that they were developing cavities, crooked teeth, and a narrow jaw. And not only that, he also noted that they were also experiencing more chronic disease in society, things like cancer, heart disease, diabetes, and even infectious disease. And we can learn a lot from the work of Dr. Price in today's day and age because, of course, we have displaced a lot of our nutrient-dense foods and replaced them with nutrient-deficient foods. And just look at how rampant chronic disease is in society today. And, of course, it's hard to find a child today who isn't wearing braces or who doesn't have fillings in their teeth. So we've seen a sharp decline in our overall health as a society and with our dental health as we have introduced these nutrient-deficient foods in our diets. Next, I'm going to be talking about the work of Dr. Hans Selye. And Dr. Hans Selye was the foremost researcher in the area of the adrenal glands. And he is also known as the father of the stress theory. And as many of you already probably know, the adrenal glands actually produce stress hormones such as adrenaline. And these stress hormones are actually to be produced when we are confronting stress in our lives, emergency situations in our lives, for example. But sometimes these stressors are less visible to us. They're not necessarily a stress like running away from a lion or dealing with lifting a car to save somebody's life during a car accident. Sometimes these stressors are less obvious, and one stressor that is very prominent today, of course, is a stressful diet. And that is what Dr. Price had noted when he traveled around the world, that he actually was studying the negative effects of a stressful diet on populations that were importing industrialized foods. And part of his observations included the fact that in these particular cultures where they were displacing the nutrient-dense foods for nutrient-deficient foods, that they were reducing their consumption of animal fat in the diet. And animal fat is actually one of the best fuels to support the adrenal glands. And so this very stressful diet is actually wearing down our adrenal glands. And so this has implications in terms of our overall health, because I really can't think of an illness today that isn't influenced by the adrenal glands. They're that important to our health. And where asthma is concerned, of course, and we'll see in a little while here, I have some slides about this, but asthma is an inflammatory condition, and when the adrenal glands are not functioning properly, this has an effect on inflammation in the body. That we need healthy adrenal glands in order to keep inflammation under control. And since animal fat is the best fuel for the adrenal glands, in order to keep inflammation under control, we really should be eating adequate amounts of animal fat in the diet. And so if you are struggling with asthma, please make sure you're including plenty of animal fat in your diet so that you can support your adrenal glands. And another implication in this area, of course, is that when we confront stress, and this can be stress of any kind, and the adrenal glands are in a constant state of reaction to stress, that can mean that we're pushing out too much adrenaline. And adrenaline, as you'll see in a second here, when we're pushing out too much adrenaline, it can cause us to overbreathe. And this leads us to the work of Dr. Konstantin Buteyko. Now, this is very interesting to me because back in 1952, Dr. Buteyko, who was a Russian scientist, he discovered the connection between hyperventilation and health. And he made this discovery by accident, actually. And back in the 1950s, he was a respiratory scientist, and so he was studying the breathing rates of patients as they were getting closer and closer to death. So he was sitting by their bedside and he was monitoring their breathing patterns. And he noticed that as they got closer to death, that they would breathe more and more and more. And so he became very curious, and he thought, well, what would happen if we reduced their breathing? Would that potentially help a sick patient? And so the long and the short of it is that he would get his patients to reduce their breathing, and case after case after case, he would see people improve in their health as long as they would reduce their breathing. And there were some very specific strategies that he would use to teach them how to reduce their breathing. And so it was a major, major discovery. It's something that's very exciting to me because I can see the connection between his research and the research of Dr. Selye and Dr. Price, and how much all of their work together combined actually helps me see how and why we're getting so sick today as a culture. And also, all of their work combined offers solutions as to how we're going to better deal with reversing many of these chronic health conditions that we're witnessing today. Here's a summary of Dr. Price's research. In essence, what Dr. Price observed was that traditional diets actually maximize nutrients, while today's modern diets minimize nutrients. And what that means is that in traditional healthy cultures, they understood the importance of soil fertility, for example. They knew to include organ meats in their diet. They understood that organ meats were the most nutrient-dense part of the animal, and so they knew to include organ meats in the diet. It's not that they didn't eat muscle meats. They did eat muscle meats, but they knew to include the organ meats as well. Animal fats were revered, not feared, as they are today. In fact, over the last 50 or 60 years, as we've been reducing our consumption of animal fat, in our diets. We're sicker, fatter, and more depressed than ever before in the history of humankind. In traditional healthy cultures, animals were out on pasture and or wild. Dairy products were raw and or fermented. Grains and legumes were properly prepared through soaking or fermentation. Bone broths were included in the diet. They used unrefined sweeteners such as raw honey or maple syrup. They consumed lacto-fermented vegetables such as raw sauerkraut. They also consumed lacto-fermented beverages such as kvass or kombucha. They didn't suffer with salt phobia and knew to include unrefined salt in their diet. Because their foods weren't overly processed, they were able to retain natural vitamins in their foods, and they also understood the importance of traditional cooking and agricultural practices. So on this slide, I'm going to show you a picture of two brothers who lived in the Hebrides Islands off the coast of Scotland. And you can see in the one brother that he had extensive tooth decay, and this was the brother that transitioned over to a processed diet. And the other brother enjoyed excellent dental health, and he maintained a traditional foods diet. He didn't switch over to eating westernized foods. And so I'm going to basically quote Dr. Price here. It's something that he noted when he met these two young gentlemen. One had excellent teeth and the other had rampant caries. These boys were brothers eating at the same table. The older brother with excellent teeth was still enjoying primitive food of oatmeal and oatcake and seafoods with some limited dairy products. The younger boy, seen to the left, had extensive tooth decay. Many teeth were missing, including two in the front. He insisted on having white bread, jam, highly sweetened coffee, and also sweet chocolates. His father told me with deep concern how difficult it was for this boy to get up in the morning and go to work. Now, boy, can I relate to that last statement, simply because, of course, for many, many years, I struggled with debilitating chronic fatigue. And, of course, my diet growing up as a child was horrible. There was no way it was going to sustain my health. So one of the main principles coming out of Dr. Price's work, of course, is this notion of getting enough animal fat in the diet. And essentially what that means is if we're getting enough animal fat in the diet, we're going to get adequate amounts of the fat-soluble vitamins A, D, E, and K, and also more minerals in the diet. So by eating more processed foods in the diet, as we see here, and as Dr. Price noted, in many cultures where they were importing westernized foods, that they had significantly less fat-soluble vitamins in their diet and significantly less minerals. So when we eat these nutrient-dense foods, we're going to get more of these very, very important nutrients, and these key nutrients actually support our overall health and, of course, our dental health as well. Here's yet another example of the negative health consequences associated with reducing a nutrient-dense traditional food like butter and replacing it with a nutrient-deficient food like margarine. In Germany, prior to the fall of the Berlin Wall, asthma was more common, as was eczema and hay fever in West Germany rather than East Germany. The main difference was that they used more butter in East Germany and more margarine in West Germany. So the message is very simple. In East Germany, they maintained a more traditional foods diet, and they actually were healthier than their counterparts in West Germany, where they were importing more of the industrialized, modernized foods. Now, this study emphasizes, again, the importance of keeping traditional foods in your diet. Here we can see that raw milk protects against asthma and allergic skin problems. In a 1999 study published by The Lancet, researchers found that the consumption of lacto-fermented vegetables was positively associated with low rates of asthma, skin problems, and autoimmune disorders in Swedish children attending a Waldorf school. The same study found that the use of raw milk and avoidance of vaccinations added to the protective effects. So in this slide, it's basically a picture of a typical North American family and what they might be buying grocery-wise in a week. While there may be some whole foods in this particular picture, the bulk of the diet is carbohydrate-based. The bulk of these foods, of course, is processed. So if we learn from the work of Dr. Weston Price, this particular family's diet is not going to be sustainable, not in terms of creating radiant health among the family. So this is sadly a standard diet for most people here in North America. and it's far from being a healthy diet. Now this picture is more closely related to what I would call a nutrient-dense, healthy diet. You can see that the bulk of the calories here would be coming from fatty animal foods like high-fat dairy products or red meat, eggs, foods along that line, and you'd be getting some other calories from whole foods such as fruits and vegetables. So to me, this diet that we're looking at here on this page is a more wholesome diet that can sustain us more healthfully in the long run. And here I'm just going to go over a few more slides showing the contrast between the dental health of primitive cultures and cultures that have transitioned over to a westernized diet. So we can see a sharp contrast on this slide from the South Pacific with some boys who are very, very healthy, have gorgeous teeth, they're eating their traditional foods, they have wide dental arches, straight teeth, no cavities, and overall excellent health. And of course these boys don't necessarily brush or floss their teeth, and they certainly don't have artificially fluoridated water, and just look at how healthy their teeth are. And then when you contrast those pictures to the others, you can see just dramatic changes in their facial structures, that the stressful diets that they had just started to introduce into their culture, of course, just wasn't working for them. You can see the rampant tooth decay, and they're also suffering with all sorts of modern diseases as well. And the similar story here in Australia, you can see the beautiful straight teeth in a culture where they maintain their traditional diet, wide dental arches, straight teeth, no cavities, excellent health. And then when you compare their overall dental and physical health to other tribes nearby that would have adopted the westernized foods, of course, you start to see rampant tooth decay, structural changes to their face, and modern diseases. Here in Africa, well, some of these tribes, of course, they may file their teeth, but aside from that, they have beautiful teeth, wide dental arches, straight teeth, no cavities, excellent health as long as they maintained the traditional diet. And then as soon as you see one generation later in other tribes that had introduced modernized foods into their culture, of course, you see rampant tooth decay and modern diseases. And again, you see their facial structures are just not what their ancestors would have looked like. So here's just a point around the work of Dr. Hans Selye, the researcher who had studied the adrenal glands. And Dr. Hans Selye, in a quote that he made, he said, "Every stress leaves an indelible scar, and the organism pays for its survival after a stressful situation by becoming a little older." So essentially, when we confront stress of any kind, it's really hard for our body to bounce back from that. And unfortunately today, we are just bombarded in our fast new world. We're just bombarded with stress left, right, and center. And so from the time we get up in the morning at, say, 7 o'clock in the morning, we're going nonstop sometimes till midnight. And we're just not giving our adrenal glands any time to heal, or as the kids today say, chillax. And so what we need to do is we need to realize that when we were evolving as a species, as hunter-gatherers, this is over 99% of human history, we probably worked about 17 hours a week. And if we exerted ourselves, it was for maybe 2 minutes at a time, and it was to eat or avoid getting eaten. And so our adrenal glands, this fight or flight system that we have in our body, it's not designed to be turned on all day long. A lot of my clients struggle with chronic fatigue, depression, anxiety, feeling wired and tired all the time. When they go to bed at night, if they're lucky, they can fall asleep, but most of my clients can't sleep, and if they do fall asleep, they can't stay asleep. And the reason for that is because internally they feel as if their body's running away from a lion, because their body is just pushing out so many of the stress hormones that they cannot relax. And of course, this has implications on our breathing, as I'll talk about in a second here. But we have to realize that this lifestyle that we're leading today in our fast new world is just not normal. Now, earlier I alluded to the work of Dr. Francis Green at the University of Calgary. And Dr. Green conducted autopsies on asthmatics who had passed away, and he examined the health of the adrenal glands to see if there was a connection between the adrenal glands and asthma. And indeed, he did find a connection there. So what he discovered was that in 90% of the asthmatics that he examined, they had some degree of adrenal atrophy, either mild, moderate, or severe. And of course, the adrenal glands play a huge role in our overall health. In fact, that's what I do in my main practice with nutritional balancing, is I'm helping my clients rebuild or strengthen their adrenal glands. So the adrenal glands are really central to our overall health. But certainly it's interesting that there's a researcher who has discovered a connection between the adrenal glands and asthma. And of course, when the adrenal glands aren't working properly, this has a role. This contributes to a lot of inflammatory conditions. And of course, asthma is indeed an inflammatory condition. So I find his research to be very, very compelling. I haven't heard of anybody else doing research in this area, so I really give him a lot of credit for connecting the dot in this area, because it is very difficult for people to heal the adrenal glands. And one thing, of course, we can do to help support the adrenal glands is make sure we're getting enough animal fat in the diet in the first place. So that's why I'm so happy to be able to connect the dots between Dr. Weston A. Price, Dr. Hans Selye, and of course Dr. Francis Green in his research at the University of Calgary. So I think that there's a way that we can actually help families help their children so that hopefully they don't develop things like asthma, is simply by using the correct diet to prevent illness in the first place. So here's yet another quote from Dr. Hans Selye about our adrenal glands. It's not stress that kills us, it is our reaction to it. Now, by reaction, he's referring to many physiological responses that we go through when we confront stress. And these reactions would include things like an increase in heart rate, increased blood pressure, increased sweating, increased adrenaline production, increased muscle tension, increased breathing rate, suppressed immune and digestive systems. And of all of these physiological responses to stress, breathing is the only response we have any significant control over, so that we can influence all other effects. And this is why I'm so grateful to the work of Dr. Konstantin Buteyko, because his breathing techniques actually will help these other physiological responses that are so damaging to our overall health. So by reducing our breathing rate, this can have a positive impact on our heart rate, on blood pressure, on sweating, on the adrenaline production, on muscle tension, on the immune system and digestive system. So the one thing that we do have the most control over through his exercises is the breathing. So if we can retrain our breathing on a daily basis, this has tremendous impact on how we deal with stress. Now, as I've been talking about Dr. Hans Selye and his research on the adrenal glands, of course, the adrenal glands, they sit on the top of the kidneys, and they are what I would call our body's batteries. They're responsible for a lot of different bodily functions, including, balancing our minerals, including helping to kick out unwanted metals in the body. But they're best known for the fight or flight response. So in an urgent situation, of course, they push out lots of the stress hormones in order so that we properly react to stress. And of course, historically, this was done under very short-term conditions. For example, when animals were chasing us or we were chasing an animal. So the adrenal glands are not supposed to be turned on very often throughout the day, just temporarily, and hopefully after we've turned them on, we know how to relax them again. So essentially, one of the reactions to stress of any kind is that it can increase breathing. And essentially, this is what causes a lot of problems in the body, because as we overbreathe, we sacrifice too much carbon dioxide. And carbon dioxide, as I used to believe, was just a waste gas. And it's not. It actually serves a very, very important role in the body, and that is that we need the carbon dioxide in order so that we use our oxygen. And so as CO2 lowers in the body, we lose our ability to optimize or properly use our oxygen. And so this has a lot of health ramifications. This slide clearly shows that we're overbreathing today here in North America, that about
90% of us are probably in a state of hyperventilation or overbreathing. When you look at the number of breaths per minute during normal breathing, being about 10 to 12 breaths per minute, each breath is approximately 500 milliliters. This provides a healthy volume of 5 to 6 liters of air per minute. And what we need to fix is not just the rhythm of the breathing, but the volume of the breathing, that we're taking in too deep breaths. And part of this is that we're breathing through our mouth. So we're sacrificing too much air by breathing through our mouth, taking in too much air and exhaling too much air in essence. And so by nasal breathing, of course, this can slow down that breathing volume. So that's just one concept that I'll be talking about during this presentation, is that we have to revert back to being nasal breathers. That mouth breathing essentially means that this will naturally cause us to overbreathe. But of course, as Dr. Buteyko discovered, as we get sicker and sicker and sicker, the tendency is that we overbreathe. And what he discovered is that as he would teach his patients to breathe less, to reduce their breathing, to do more nasal breathing, for example, and other exercises, that this would help improve their health dramatically. So this is the concept that Dr. Buteyko discovered in 1952. And I'm glad it's finally, making its way here in North America, that we're learning about this technique. And it just does seem so basic and so simple, but we take breathing for granted, and we can unconsciously be overbreathing and not know it. So in order to fix this situation, it may take some training to get you to recalibrate your breathing so that you're breathing at a more normal, natural, healthy rate. I'm going to give a brief overview here of how overbreathing or hyperventilation can make us sick. First, hyperventilation lowers carbon dioxide, thereby impairing oxygenation of the tissue. And remember, we need carbon dioxide in order to be able to use our oxygen. Next, it causes airway irritation. And the reason why this happens is because carbon dioxide is actually a vasodilator. It causes systems in our bodies to relax. And so as we lose carbon dioxide, it causes airways to constrict. And of course, that also means that the nose can block. And this is a defense mechanism, because Mother Nature causes that nose to block in order so that we can rebuild our carbon dioxide. But instead of reverting to nasal breathing like we should, instead we can feel suffocated and revert to mouth breathing, which causes us to lose even more carbon dioxide, making matters worse, of course. And as we revert to mouth breathing, this can adversely affect the structural development of the children. So what that means is, and I'll talk a little bit more about this later, if we're nasal breathers, the tongue should rest at the roof of the mouth and act as an anchor or a retainer to properly shape the jaw. And if we are mouth breathers, the tongue drops to the floor of the mouth, and now we no longer have that anchor or that retainer to properly shape the face. So this can actually cause children to develop less attractive features. And finally, hyperventilation can lead to muscle spasms and increased tension. Because carbon dioxide is actually a vasodilator, as I mentioned, as we lose carbon dioxide, it can lead to tension throughout the body. So learning about the work of Dr. Buteyko has been a real revelation for me, because if I back up and I look at learning about the work of Dr. Weston A. Price, first and foremost, I understood then the importance of nutrient-dense foods on our overall health. And then studying the work of Dr. Hans Selye and learning about the importance of the adrenal glands on our overall health was also a huge revelation for me. But connecting the dot between Dr. Price and Dr. Selye meant that I had to understand the importance of eating enough high-quality animal fat in the diet so that I could therefore support the adrenal glands. And then if we extrapolate from their work and lead on to the work of Dr. Buteyko, of course, when the adrenal glands are stressed, we would have a propensity to overbreathe. And a stressful diet, of course, is just that. It's stressful. So when eating a stressful diet, as we have been now for many, many decades, it's no wonder that
we have this issue around hidden hyperventilation. So we're overbreathing and we're just simply not conscious of it. I know I certainly wasn't. So I think it's really important to retrain ourselves so that we can calm our breathing down and therefore support our overall health. And I feel like it's just the missing link to this puzzle that we're all basically stuck in today, trying to figure out how to get our bodies well after living such stressful lives and following such stressful diets. Now, as I mentioned earlier, Dr. Buteyko discovered the connection between overbreathing and illness back in 1952, but his discovery really only made its way into the Western world in the early 90s, and that was in Australia. So it's now only making its way into North America, and it's best known as being a treatment for asthma, rhinitis, snoring, and sleep apnea. In the British Thoracic Society guidelines in 2012, they state that the Buteyko breathing technique may be considered to help patients to control their symptoms of asthma. The guidelines of the Global Initiative for Asthma, or GINA, state on page 40 under Advice Recommendation for breathing techniques may be a useful supplement to asthma pharmacotherapy. The document assigns it an evidence level of A, meaning that there is a rich body of data with randomized clinical trials and meta-analyses. And here's a great quote from Dr. Buteyko, which I think encapsulates his work. Noisy and deep breathing of an asthmatic had always been considered an outcome of the disease. Nobody could even suspect that deep breathing was the cause of bronchial asthma, and increased depth of breathing could provoke the appearance of the symptoms of the disease. So there are indeed 9 published studies investigating the Buteyko breathing technique as a treatment for asthma. All studies demonstrated significant improvements to asthma control, with a number of trials showing a 70% reduction in the need for asthma reliever medication and a 50% reduction in the need for asthma steroid medication within 12 to 24 weeks, which I believe is a very short period of time. The longer an individual can discipline themselves into practicing these breathing techniques, I think the better the outcome is going to be over a longer stretch. But still, for a 12 to 24 week period, these results are really very, very promising. And of course, asthmatics actually overbreathe. They breathe more than the general public, who is already overbreathing. And so this particular slide shows that asthmatics actually breathe 2 to 3 times more than normal. And so it's a real serious problem. If you're ever in the room with an asthmatic, you can usually tell because you can hear their breathing. They usually have very noisy breathing, and you can hear them almost like gasping for air. So we know that asthmatics are sacrificing too much carbon dioxide, which would in turn constrict their airways. And so they're setting themselves up for the asthma simply because they're in a constant state of overbreathing. Now, I want to give a brief overview of the history of asthma. There was a dramatic increase in asthma rates in the late 20th century. An estimated 100 to 150 million people in the world currently have asthma. Asthma is from the Greek word asein, which translates as to breathe with open mouth or to pant. It was treated as far back as 2000 BC by Chinese doctors with the herb ma wang. The first known recording of asthma symptoms dates back about 3,500 years ago in an Egyptian manuscript called Eber's Papyrus. And asthma was not considered to be associated with increased mortality until the 1930s with the advent of bronchodilator medications, which I find very, very interesting because historically, when people struggled with asthma, typically they didn't die. So this notion that people are dying from asthma today is actually quite new and is associated with the advent of medications. Now, this is not to say that people should stop using their asthma medications at all. I just think that this is very telling, and it should provoke us to start asking more questions and looking for potentially some more sustainable, viable solutions to help solve this crisis. So there's a vicious cycle associated with asthma, and it starts when we overbreathe. And of course, if we're mouth breathing, this means that we're going to be overbreathing naturally because the mouth is a larger cavity than the nose. So in breathing through the mouth, we can sacrifice too much carbon dioxide. And so as we lose too much carbon dioxide, this causes airways to constrict. And remember, we need that carbon dioxide in order to keep the airways open. So overbreathing causes airways to constrict, and as airways constrict, we can feel suffocated. As a result, our breathing increases to try and remove this feeling. However, this increase of breathing volume further feeds our symptoms, causing greater constriction, and thus a vicious cycle is maintained. So essentially, hyperventilation lowers carbon dioxide levels in the body. And let me just show you a couple of slides that show what happens when carbon dioxide levels fall. So when we overbreathe and sacrifice too much carbon dioxide, the first thing that happens is that the blood holds onto its oxygen more tightly and less oxygen gets to our tissues. And this is represented in this picture of the brain. And this is the same person under normal breathing circumstances and under hyperventilation. So after 1 minute of heavy breathing, you see that there's just less oxygen getting up into the brain. And the red and yellow areas show that they're high in oxygen, and the blue and green areas are low in oxygen. So this is quite a dramatic change in the brain under two different circumstances, under normal breathing and under hyperventilation just for 1 minute. The second thing that happens when we sacrifice too much carbon dioxide and therefore are not properly using our oxygen is that the person can experience smooth muscle spasms. All tubes in the body and hollow organs are surrounded by smooth muscle that twitch and spasm when carbon dioxide levels fall, causing, amongst other things, narrowing of airways and narrowing of blood vessels. So this has huge ramifications on the whole person, but specifically where breathing is concerned, it can become more difficult to breathe normally. And so this is part and parcel as to why asthmatics have this particular condition, is that they've lost so much carbon dioxide, it tightens the airways and they have a very difficult time breathing. Here's a flow chart that shows what can happen when an asthmatic is exposed to a trigger. And in some individuals, it could be exercise, it could be laughter, it could be cold weather, it could be an environmental toxin of some kind. But at any rate, when an asthmatic is exposed to a trigger, they're already hyperventilating as it is, but the trigger causes stress on the body and therefore can increase hyperventilation even more. The individual is already stressed, and then the trigger just basically amplifies the stress, and this causes an increase in hyperventilation, which causes even more of a loss of carbon dioxide in the body, which further constricts the airways. And essentially, this is what causes the asthmatic to gasp even more for air, and then it just seems like a never-ending cycle that they just can't escape the discomfort of being an asthmatic. So the goal in the Buteyko breathwork is to teach the asthmatic how to breathe less through various exercises so they can gradually build their CO2 and then eventually calm the airways so that they are relaxed, so they don't have this propensity to constrict. Here's an image of what that looks like. So the loss of CO2 caused by overbreathing leads to constriction of the airways. By breathing calmly and quietly, you will retain healthy levels of carbon dioxide, and your blood vessels and airways will remain open and clear. So this is the essence of the Buteyko breathing method, is to have individuals who are struggling with breathing problems go through a series of various exercises that help build the carbon dioxide in the body, that help to retrain the individual to breathe more quietly and calmly. And then gradually, this will improve their breathing patterns. I want to share with you a study that was published in 2013. In collaboration with the University of Limerick, Patrick McEwen was the instructor in a clinical study investigating the Buteyko method as a treatment for rhinitis in asthma. Results showed a 70% reduction of nasal symptoms in participants, including snoring, loss of smell, nasal congestion, and difficulty breathing through the nose. Now, I'm very pleased to have taken my training under Patrick McKeown. He's a world-renowned Buteyko instructor and author of several books on the subject. And as you can see, he's also hands-on in proving the science behind the benefits of this method. On this slide as well, I want to point out the picture of the little girl. And I want to point out that, we can see that she's a chronic mouth breather, that her blocked nose has forced her to become a mouth breather. And tragically, this has deformed the shape of her face. And the reason why this is because when we are nasal breathing, which is optimal, the tongue sits at the roof of the mouth. And when the nose is blocked, of course, we resort to mouth breathing and the tongue drops to the floor of the mouth. And it can no longer act as a retainer or mold to properly form the shape of the face. And I'm going to show you some more examples of that in a bit. But if she had actually been taught how to nasal breathe, then of course she would have more attractive facial features. I'm going to do a brief exercise demonstration to show you how to decongest or unblock your nose. And there's Patrick McKeown himself. He's actually teaching a room full of children how to decongest or unblock their noses. And Patrick McKeown, of course, is very well known in Ireland, but he's also very well known all around the world as a Buteyko instructor. So essentially, to do this exercise, you take a gentle breath in your nose and a gentle breath out through your nose. And on the exhale, at the end of the exhale, you're going to pinch your nose with your fingers to hold your breath. And you're going to hold your breath for as long as possible. And while you're holding your breath, you're going to sway or nod your head as a distraction. And then when you have to take your first breath, you're going to try and take that breath through your nose, but you may not be able to, especially if it's still very congested. And then you're going to wait about a half a minute to a minute, and you're going to repeat this exercise 6 times. And hopefully, by the end of the 6th breath hold, your nose should be open, it should be clear, and you should be able to breathe naturally and normally and quietly through your nose. Throughout the day, you may find you need to repeat this exercise several times, especially if your nose is very, very congested. But it is very, very helpful to clear the nose and become, therefore, more aware of nasal breathing. Now, it's important to note that the nose isn't just for smelling. It actually helps to warm the air, filter the air, humidify the air, and it actually helps to disinfect the air as it passes through our nasal cavity. In fact, in our nasal cavity, we produce some nitric oxide, and nitric oxide is a natural germicidal, so it's really very beneficial to breathe through our nose for a variety of reasons. In fact, if you think about it, our mouth is not intended for breathing. It is actually intended for speaking, drinking, eating, but it's not intended for breathing. So we really do need to focus more on nasal breathing, and we see here that there are many added benefits to breathing through our nose. So as the air passes through our nose and we get the benefit, the germicidal benefit of the nitric oxide, this can protect us against upper airway disorders. So uncorrected open mouth breathing can result in enlarged adenoids, tonsillitis, nasal polyps, sinusitis, and chronic nasal congestions. And there are even more benefits to nasal breathing. Nasal breathing isn't just good for helping to disinfect the air as it comes through our nose or to help reduce our loss of carbon dioxide. It also helps to develop beautiful faces and straight teeth. Now, I think the vast majority of the population believes that crooked teeth are normal for humans when indeed they are not normal for humans. In fact, crooked teeth are a modern day phenomena. Even as late as the 1600s, crooked teeth, while present amongst the wealthier class, affected only a small portion of the population. Research has shown that this degeneration has become more marked within the past 400 years, and in European countries again appears to be linked with social progress and possibly a change of diet. Now, this is according to Dr. John Mew, who's an orthodontist, but he's a very progressive orthodontist in that he uses non-invasive approaches to straighten the teeth of his pediatric patients. And he also encourages them to nasal breathe. But let me go back to this idea that crooked teeth became more apparent about 400 years ago. Actually, we can go back further in history to about 10,000 years ago when we start to see dental issues surface in humans. So 10,000 years ago was an era when humans were converting over from being hunter-gatherers to a more agrarian society. So we invented agriculture about 10,000 years ago. And when we invented agriculture, we started using grains like wheat or barley to displace the more nutrient-dense animal foods. And that's when we start to see tooth decay. That's also when we start to see osteoporosis set in humans. And also humans began to shrink. Actually, we were much bigger when we were hunter-gatherers than when we switched over to an agrarian society. So we can actually go deeper back in history to see that dental issues surfaced about 10,000 years ago, but certainly as we started eating more and more processed foods in our diet, we start to see more and more dental problems, including crooked teeth. And here's just some more faces of some of Dr. Mew's patients. The black and white picture is of a young boy who, as a very young child, was a nose breather and had a beautiful shaped face, but then he actually got a gerbil and was allergic to the gerbil and began to mouth breathe. And you can see the shape of the face, how it elongates essentially. And he develops a narrow jaw and other distortions in the face. And this could have been prevented had he just maintained being a nasal breather. And the color images beside the young boy, these are two sisters, and one sister is a nasal breather, and you can see how beautifully shaped her face is compared to her other sister beside her, who actually is a mouth breather, and her face is again longer and distorted in shape. So it's just a couple of examples of what can happen if we are mouth breathers as children and what it will do to distort the shape of our face. Here's a study that was done back in the 80s and 90s by a Dr. Harvold. Now, the study sounds gruesome, but it does show that converting to mouth breathing does distort the shape of the face. And what this doctor did was he blocked the noses of the monkeys to force them to breathe through their mouths. And all mouth-breathing monkeys developed abnormal growth of the face and jaws. And children, of course, are affected similarly. Open mouth breathing leads to changes in the growth of the face with impairment of development of the lower jaw relatively early in life. And so it's really important to catch children at very young ages if we expect their faces to develop normally. And so it's great to be able to learn these techniques in order so that you can start using them on your children at a very, very young age so that they can develop beautiful faces. Now, when we breathe through our nose, this means that the tongue is sitting in the roof of the mouth and helps to ensure wide dental arches and straight teeth. Just to give you an idea of how much influence the tongue has on the shape of the face, the tongue is one of the strongest muscles in the body, capable of exerting 500 grams of pressure. And it only takes 1.7 grams of pressure to move a tooth. So that just gives you an idea of what a strong retainer the tongue really is. And of course, when we breathe through our mouths, this means that the tongue is sitting on the floor of the mouth, and this can potentially distort the shape of the face, because the tongue is simply not in the correct position to shape the jaw. So the consequences of chronic mouth breathing include crooked teeth, narrow dental arches, receding chin, smaller jaw, protruding nose, narrow airway, and even the risk of developing obstructive sleep apnea into adulthood. So who are the people that I would expect would come to me looking for help? These would be people struggling with asthma, chronic nasal congestion, allergic rhinitis, sleep apnea, chronic snorers, or parents of children who are chronic mouth breathers, and for dental reasons, they'd like to convert their children over to nasal breathers. Now, there's a right way to do the Buteyko method and a wrong way to do the Buteyko method. It's not just as simple as assuming that you're a nasal breather and you're okay, because nasal breathers can still overbreathe. And if you're a mouth breather and you think you can convert to nasal breathing overnight, again, it's just not that simple. It is good to have a coach to help guide you through how to retrain your breathing properly. So when I'm working with my clients, I'm helping them to normalize each aspect of the breathing pattern. And that includes correcting the rate, the rhythm, the volume, and the mechanics of the breathing. And this is done through a series of structured breathing exercises that can be done over several weeks. And then eventually, when you build your CO2 and retrain your breathing, you will unconsciously and naturally breathe healthfully for all situations, when you're awake, asleep, at rest, eating, shopping, speaking, and even when you're engaged in physical exercise. So what is incorrect breathing? Incorrect breathing is breathing through the mouth, hearing breathing during rest, sighing, snorting, and sniffing while resting, yawning with big breaths, taking large breaths prior to talking, visible movements of the chest and tummy, and noisy breathing. So when I'm working with my clients, the goal is to teach them how to breathe correctly. And this means teaching them how to breathe quietly, calmly, invisibly, in and out through their nose. And finally, when they achieve this goal of nasal breathing and making sure that they're breathing quietly, calmly, and invisibly, then this means that they're going to increase their arterial carbon dioxide by 20% and oxygen by 8%. And of course, this has huge health benefits. As a society, there's a lot we can do to protect the next generation. And our children today are suffering. They're suffering mentally, they're suffering physically, and it's unnecessary. We can prevent this disaster from getting worse. In fact, we can do many things to help offset the health crisis that our children are going through today. And thanks to the work of Dr. Hans Selye, Dr. Weston A. Price, and Dr. Konstantin Buteyko, there are many measures that we can undertake to help support their overall health. And this is essentially the reason why I wrote my books, Addiction, the Hidden Epidemic, and Survival of the Unfittest. They are both a call to action, that we need to step forward as a society and do more to protect the most vulnerable citizens around us, our children. So for more information about my coaching program to help retrain your breathing patterns, visit my website, which is just my name, www.pamkilleen.com. Or if you'd like more information about the work of Dr. Weston A. Price, visit the website www.westonaprice.org. I also have several teaching seminars that are available at Vimeo On Demand, and most of my seminars actually center around the work of Dr. Weston A. Price. And the titles include Copper's Role in Dental Health, Solving Adrenal Burnout, Sexual Healing, Simple Solutions for Bad Digestion, In Memory of Three Square Meals, Corruption in Science, and Dirty Little Secrets of Big Food.